Who's ready to talk about population health at 9:45 in the morning? Aren't we all? It's going to be fabulous. Woo! Here we go. Thanks for joining us, guys. We know it's early. We're in the third day of HIMSS. It's got to be it's got to be fun to talk about this. But I am Therasa. I sit as the president and founder of Know2. We serve as the nation's largest communication network, both by the number of endpoints that we connect and the number of fabulous partners that we have, including PointClickCare, which many of you know the name of PointClickCare. They're everywhere in healthcare. I am accompanied by my esteemed colleague, Misty LaFave, so I'll let her introduce herself, and then we will jump right in.
Thank you, Therasa, and it's a pleasure being here. It's really exciting to be at HIMSS. I always get energized to connect with everybody and understand everybody's challenges and the things we're trying to solve together in healthcare. I'm Senior Director of Interoperability and Product Management at PointClickCare, and I'm responsible for really connecting the pathways for our skilled nursing facilities and our senior care platforms, but also across the acute and payer spaces. And we partner with Know2 to really help us connect the continuum of care and the data across those journeys. So PointClickCare is originally a skilled nursing EHR, but as you can see, we really have broadened across both the post-acute space as well as the acute space, and really connecting that journey with over 2,800 hospitals, over 12,000 skilled nursing facilities. We're in assisted living and really helping that journey across their patient journey across the care continuum to ensure they're getting the care they need at the right time, and really providing that information to the providers that are seeing them to ensure that they're driving down readmissions, understanding the patient as they're in that care setting.
So I can say I've been in healthcare for about 25 years, working especially in the interoperability space, and with population health getting all the rage in the last few years, it has not been a conversation where population health and post-acute have been used in the same sentence, but now it is, and especially with PointClickCare participating. Tell us why now is the time for post-acute to be involved in this conversation, and how PointClickCare is participating in that.
Yeah, that's a really important question. I think for a long time, the post-acute journey for a patient's really been a black box and really a black hole of data. And so what we're really trying to see is how to, that's an important part of the patient. A lot of the care transitions that happen with skilled nursing, as well as the connections that happen in that skilled nursing that are being missed, possibly early interventions, and what's happening for the patient in that post-acute space. And really trying to bring that data together and really start to help the care team that's overseeing that patient while they're in the skilled nursing, or once they leave the skilled nursing, what do they continue to do? So really, as we connect that data and really helping that patient across the journey and seeing how they transition between cares, and really taking that black space or that black hole that was there before and really bringing it to the forefront and really being able to connect that data. And then as we connect that data, we're able to provide insights to her care providers at the hospital, at her care team, at her PCP, so that she can continue her journey and have early interventions and reduce readmission risks.
Do you like how we have to share the microphone? Works well. So let's double click on that, Misty. You talk about the patient being able to transition across all these care settings. What does that look like? How can we make sure that the care teams in these, from the acute all the way through the post-acute settings and on, that they can be informed with the right data using PointClickCare's connectivity tools?
Yeah, so let's talk about a patient as they discharged from a hospital. Maybe they're recovering from a heart procedure, and so they need additional nursing care. So they transfer into the skilled nursing facility. As they are doing that transfer, we're actually able to bring in her records for the nursing administrator and the care team at the skilled nursing facility, so that they can see what were the medications that she was prescribed, what are the doctor's notes of how her care should continue to progress, what are her allergies and immunizations, and really taking all of that data and reconciling it directly into the chart from what came over from the hospital so that the care team can coordinate and collaborate her care with her primary care physician and her hospital stay and the care team that's overseeing her. But while she's in the skilled nursing facility, we're also giving tools to the care team of showing how Margaret is progressing at the skilled nursing facility. So with our post-acute management system, we can actually, her care team can see how she's progressing, what her vitals are, if she's got a readmission risk. We're using a algorithm to detect how high of a risk, how she's trending for readmission so that it can provide early interventions and reduce those readmission risks and drive down readmissions. I think over the last 12 months and some of the success stories we're hearing is we're driving down readmissions by 30% for patients while they're in the skilled nursing. And that's really what population health is about, is producing better outcomes for patients across the care continuum. And by doing that, we're driving down the costs to the healthcare system as well.
So touch on that a little bit further. We talk about, it's always interesting to me because we talk about readmission with post-acute and that we're trying to use it for readmission avoidance. And so then I argue that it should be called post-acute. I think it should be called pre-acute. For a long time I've think that because that is our intent. But let's move into value-based care a bit. How does it help value-based care teams or those that are at risk with some of the PointClickCare tools?
Yeah, so as we're connecting the care across the continuum and really helping that care collaboration, you're really able to then hone in on how the patient's doing, and the care teams can actually see the data in real time and actually act on that data and provide actionable insights. And I think as you're providing those actionable insights, both for the care team as well as supporting the skilled nursing facility of whatever care setting that Margaret's in, helping them get to the right cause of understanding. Maybe there's a medication change. Maybe she had an adverse reaction to a medication, or she's not doing well. So really having that communication path, utilizing the insights and allowing her care team to have that understanding and driving that down. We've also been utilizing AI to really help get that information at the right time. So if Margaret were to, sorry, I'm mixing up. We were doing a demo on Margaret, so you'll have to come after this. So Margaret, if she were to leave the skilled nursing facility and maybe she doesn't have a good home health or something happens during her home health and she winds up into the ED, we're actually sending a notification from the ED to alert the skilled nursing that Margaret has been readmitted or that she's in the DED, so they can intervene and coordinate with the ED team. But we're also providing insights through a SNF summary to help the ED doctors and staff to understand Margaret just came from a skilled nursing facility. She was there for a heart attack and she was recovering and she's been discharged for 7 days. And so it really informs not only the ED teams but also her care teams. And then having those early interventions and driving better outcomes is really how we support VBC.
So fast forward the clock. We sit here today. Technology is changing everything. Care is changing fast. Care models are changing fast. What does it look like in 2 to 3 years for those that are on the PointClickCare connected system?
So I think today we're really focused on the treatment use cases and that admission workflow and discharge workflow. But I think it goes beyond that. Obviously, I'm sure all the buzz is around AI, but it's bringing that data together and making it more useful and more impactful and ensuring that that data is actually providing more insights and really actionable insights. I think the days of the keyboard are not always going to be there. It's really getting the information where it needs to be in the right time. And so as we see that advance, it's going to lean in more on referrals. We're going to see more, I think, bringing payers to the table, having more types of data that we can really harness and bring in to be actionable is where I see it continuing going, is like how can we build what we've already done around treatment and improving how we get more data at the right time to the right providers.
Sorry, try to do it. I know you have a teaser, right? So you have an announcement that you'd like to prepare for the audience. Is that true? Is that still true? Are we still there? Want to make sure she has a chance, but as she had mentioned, right here in the showcase, directly back from us or vertical from us, there is a whole continuum that is connected. I'm being told to hold the microphone closer. There's a whole care continuum that's connected, and in there you can see that everything that's happening around the health system. For a long time, we've thought about healthcare as only health systems and physicians. And healthcare is such a wide word, and we think about where healthcare should be taking place, where we want to keep people out of the hospital, keep them out of the most expensive care setting. Healthcare represents everything that sits in a skilled nursing, facility-based care, in the home, therapy-based care, behavioral health care. It's a wide word, and the ability to connect the continuum and feed the platforms like PointClickCare's platform, where they can provide valuable insights from every care setting, is really important as we seek new care models and we seek to drive different care models. So I'm going to let you give your teaser, and then we'll wrap this up with any questions. Feel free to take them from the audience.
Thank you. So we did launch, we have a PointClickCare booth upstairs. It's over kind of by the entrance, so would love to see you all there. But we did announce our post-discharge summary this year, and we are doing some exciting things around our referral agent and providing those direct insights not only to the skilled nursing facility but also to the acute providers, so they can see how their patients are doing and getting that information so they're not having to really dig for it and bring those insights at the forefront. So would love to see you all at our booth. We can definitely do some demos up there of some of our new tools, as well as the PAC management that I talked about and our EDO, the ED optimization.
Well, thank you, Misty. Let's give her a round, and we appreciate all your time today.